Hi, this is Sarah Jones. I am going to be presenting Delirium and Assessment Intervention for Nursing 404 Leadership and Management in Nursing from Murray State University. It's November 20th, 2015, and this is Dr. Carol Murch's class. This is the summary of my clinical project for this class. Background. This is delirium. It is a condition characterized by acute onset of fluctuating alertness, impaired memory, impaired attention, and disorganized thinking. It mostly affects the elderly, but it can occur in any patient. My problem statement is nurses on step-down ICU at St. Mary's Hospital are having difficulty identifying, assessing, preventing, and treating delirium. There are many risk factors, and most delirium cases are preventable through simple nursing, assessment, and intervention. Delirium has been found to increase fall risk, increase length of stay, and increase hospital costs. Purpose of this project is to increase nurses' knowledge of delirium, assessment, and interventions on step-down ICU in order to produce better patient outcomes. My first objective was that nurses will display improved knowledge of delirium risk, signs, symptoms, assessments, and interventions. Objective 2 was that nurses would perform delirium assessments correctly, and Objective 3 was that nurses would implement nursing interventions with patients in a positive delirium screening. My project plan. I researched several articles on delirium and its assessment and intervention. Delirium is already present in an estimated 10 to 15% of elderly patients, and it develops an additional 10 to 40% of elderly patients once hospitalized. I discussed delirium with my clinical preceptor, who is the clinical resource nurse for step-down ICU and the cardiovascular service line at St. Mary's. She agreed it was a good idea to address this, and she took me to ICU so I could observe delirium assessments. ICU at St. Mary's has been performing delirium assessments for a few years now. They use the Confusion Assessment Method, or CAM method. The research I found supports this method of delirium assessment. The CAM has 4 major assessment areas. 1 is acute onset of mental status change or fluctuation of mentation. 2 is inattention. 3 is disorganized thinking. And 4 is altered level of consciousness, where a positive screening is 1 and 2 together, or 3 and 4 separately. I did a general knowledge assessment of the nurses on step-down ICU, and 71.42% of the nurses stated that they knew the difference between delirium and dementia. Since they are similar, sometimes nurses have difficulty determining which is which, but only 28.57% admitted to knowing how to assess, prevent, and treat delirium. I performed multiple in-services on day and night shift, and then walked around and offered help with assessments and interventions. I presented this information to the nurses. The risk factors included medications, particularly benzodiazepines and anticholinergics, bowel and bladder dysfunction, and making sure nurses were aware of the last time their patient had a bowel movement and the last time that they voided, infection leading to sepsis, severe pain, alcohol, sedative, pain medication withdrawal, dementia, new surgery, in particular heart and hip surgeries, poor eyesight and hearing, making sure nurses knew if their patients wore glasses or hearing aids, age greater than 65, hospitalization, and polypharmacy. And nurses on step-down ICU did report that their patients typically took at least more than 5 medications. Symptoms presented to nurses include acute onset of confusion, differing answers to orientation questions, altered thought process and reasoning, acute hallucinations, and fluctuations in signs and symptoms. And then nursing interventions that can be performed without a doctor's order is keeping the patient's lights on and opening their blinds during the day, getting the patient out of bed in a chair position or ambulating 2 to 3 times a day unless there is a physician's order for strict bed rest, reorienting as needed, making sure that nurses keep a clock and the date in view of the patient at all times, play music and TV the patient likes, and encourage family members and friends to talk to the patient about memories that they know very well. Nurses were also encouraged to notify their physicians about a positive delirium screening. This is the project results. I performed a second general survey of nurses, and the nurses showed an increase in general knowledge of delirium. The nurses reported that they felt their delirious patients seemed to improve mentally with delirium interventions. 100% of the nurses surveyed were able to accurately describe delirium. Most nurses listed on average 4 to 5 risk factors for delirium and were able to list an average of 3 to 4 different interventions for delirium. 57.14% of the nurses performing delirium assessments on every patient they assessed. 28.57 reported infrequent delirium assessments, usually reporting that they assessed the patients that they knew would be positive for delirium. And then another 14.29 reported not performing delirium assessments at all, usually citing time constraints and unfamiliarity with the CAM assessment method as their reason for not performing. Evaluation of the data. Nurses on step-down ICU demonstrated improved knowledge of delirium assessment and intervention. Outcomes like decreased fall rates, hospital costs, and length of stay are not able to be calculated at this time since these interventions have been implemented for about a month. Nurses did state that they felt implementing delirium assessment and intervention had made patients appear more alert and able to participate in therapies and treatments more. Conclusions and future implications. Delirium assessment and intervention can be time-consuming. Nurses on step-down ICU seem to be implementing the delirium training and using it to their own as patients' advantage. Some more training and refreshing of knowledge may be needed in the future for nurses who still haven't gotten used to this assessment method. Summary: delirium can affect any patient in the hospital, particularly the elderly. Nurses showed improved knowledge of delirium, correctly performed delirium assessments, and correctly implemented nursing interventions for positive delirium screenings. By providing in-service and one-on-one assistance where needed, I have helped step-down ICU nurses achieve these goals. By using pre- and post-education tests, I was able to measure the nurses' knowledge growth. Importance of delirium in assessment and interventions. Delirium has been shown to increase fall risks, lengthen hospital stay, and increase hospital costs. Performing delirium assessments and interventions can help decrease these risks and improve patient outcomes. Delirium is an important condition that nurses either need to prevent or identify quickly and treat. All nurses are capable of performing this assessment and interventions, no matter what level of care they work in. And here are my references. Thank you.